Time now for this week's Health Matters. Paul Critz here. I've got Lynn Szabo, PA, in the FUG house, and we record these on a Sunday. It's a nice autumnal Sunday out there, and today we're going to discuss asthma, and I have a very basic question to begin with.
Okay.
Just generally, what is asthma?
It's a chronic inflammatory disease, and that causes intermittent airway obstruction. And it can be kind of triggered by a number of different reasons.
Okay, so another inflammatory condition. That just sort of seems to be when things suck in the human body. Inflammation seems to be.
Darn inflammation. Inflammation does good things too, to be fair.
What does inflammation do that's good?
Well, let's say you got a big MRSA on your bottom or something. The inflammatory response is helping you get better.
Okay.
Sometimes the inflammatory response is appropriately applied, and sometimes not. This is a case of not.
Yeah. Okay.
So, it's actually the reason I keep coughing on and off through all these recordings. So some kinds of asthma is more like a hyperreactivity. So that what that means is the lungs knowing when it's appropriate to cough, like they just inhaled a bunch of diesel fumes, and coughing is a protective mechanism. And then coughing just because you took a breath of cold air. So one appropriate, one not appropriate. So the lung function is a little bit confused on that. And
Wait, you're not supposed to cough if you take a breath of cold air?
It's a common trigger. No, you're not.
Really?
You? Yeah.
I don't know. It's been, I don't know the last time I was in a... I catch my breath. You know, you do that if you step outside and it's like, zero, below zero.
It's just that hyperreactivity that you cough when you're not supposed to.
Okay.
So, and you can reverse it with meds, or it can spontaneously go in and out. And this, I think, is an important point, because I've heard a lot of people tell me they don't have asthma because they're not wheezing at that moment.
Okay.
And so that doesn't mean you don't have the disease. That just means that your symptoms are not bothersome at that moment. So any provider listening to somebody's lungs, if the patient's complaining of like increase in cough and abnormal wheezing and maybe some shortness of breath, just because they're not wheezing right then doesn't mean there isn't something going on.
Okay.
So I think patients should know that. It's super untreated. That kind of goes along with what I just suggested. Super untreated in the United States, resulting in a lot of morbidity and mortality.
Do you have any numbers as far as
no, I
people
didn't. I didn't get any, but it's kind of probably mostly on a cofactor with pneumonia and things like that. And then when it gets really bad, heart disease. The lungs and the heart are kind of like hand in hand, and when one's not doing well, eventually the other one won't do well. So the cause is probably genetic, and it has an environmental component. And, asthma is kind of an interesting disease if you look at racial disparities in medicine and health in the United States. One of the triggers for a group of people that might have a genetic tendency toward asthma is things like pollution. And so, as that was relevant to Humboldt County at one time when I was first up here as a new PA and the pulp mills were still going, I saw a ton of kids living kind of in that side of Eureka who had big asthma problems.
Oh, sure. Wow.
So, kind of like wealth disparity and where people end up living and what they're exposed to when they're living there. And kind of defines how their health goes for the rest of their lives. I
always equate pulp mills with just that smell of like a fart in a wet paper bag. And this used to be where we are here. It just all the time when I was a kid on Elk Valley when Hambros was a deal. And it never occurred to me to think about it in terms of pollutants.
No, and it triggered a lot of people to get asthma who wouldn't otherwise have gotten it. And there's also a racial disparity.
Sure.
People of color definitely get asthma more. And people who are African American actually die of asthma more.
Oh, my God.
Yeah.
Is there any reason for that? Or is it, again, just a class
I think there's a
wealth?
genetic thing, and then there's a wealth thing.
Okay.
So there's like a where you live thing, and there's a how you access care thing. I mean, it's layers of sad things.
Yeah. So I went to the Google machine, and it's saying that approximately 25 million, or 1 in 13 Americans suffer from asthma in some form. I didn't drill down whether it's undiagnosed.
Miserable. And when it's scary, like if you're in the walk-in clinic across the street from Sutter and you see somebody with a really remarkable asthma attack, it can be like called call the ambulance time. It can be remarkably terrifying for a provider to see that kind of problem breathing. So triggers can be like viral illnesses, pneumonias, allergies, chemical irritants, like we talked about, something as simple as cold air, cigarette smoke, exercise. So a lot of teenagers will have been diagnosed with asthma when they were little kids and then told they would quote unquote grow out of it, which is never a thing.
Okay.
But symptoms will be better as they're teens and young adults, except when they have to go to PE or they have to run the track, and then all of a sudden they'll be back.
Is asthma onset caused by athlete? I mean, I seem to remember like there are athletes I've heard of who developed asthma in their training. Is that a thing?
Yeah.
Okay.
And I mean, again, you're talking, who's that woman, Jackie Joyner? Mm-hmm. No, she has a better name, but who actually died of asthma?
Oh, wow. Okay. Yeah. Yeah. But is that something, I mean, you don't have asthma and then you just work out so hard for so many years you can develop the condition, or was it there and then triggered?
No, she had a genetic predisposition.
Gotcha.
And then something triggered it, and it was made worse by her working out, it probably wasn't able to be controlled well. I'm sure she had great medical advice and perfect understanding of what was going on with her. Right. But unfortunately, she died of it.
Wow.
Yeah. So diagnosis, it's usually a clinical diagnosis, and this is where the average Del Norter ought to have a little bit of awareness. So if a provider in the room who is familiar with somebody's case sees somebody long enough and will say, well, I think we're looking at asthma here, it would be good to verify that with pulmonary function tests, because as we say in medicine, all that wheezes is not asthma. So there's little sayings in medicine. This is one of them. And it's probably been lost in my generation. And the younger generation of providers, I don't think, understand it as clearly. There's a whole bunch of things that cause wheezing. And so pulmonary function tests can help define whether somebody really has asthma or if they have one of those other things, or more than likely have combinations of things. So pulmonary function tests, to get those are in Del Norte County and Humboldt County, really, really difficult and booked out in months.
Wow.
So this is an example of how COVID still continues to affect our community.
How so?
Because they shut down the pulmonary function tests during COVID because, you're taking big breaths and you're doing rapid exhales and stuff like that. And that was risky for the person that was in the booth with you.
It turned you into sort of a mini super spreader event right there. Yeah,
exactly. Yeah. And so they cut that out, and they also coincidentally, or just of interest, cut out giving nebulizer treatments in clinic. So you can't really, as a provider, you don't have any data that make you understand what's going on better, and you don't really have any treatment that might, a therapeutic trial that might add to your understanding.
So these therapies that you're talking about, I mean, I can tell with especially with Open Door going in there, while the rest of the community has just moved on and the pandemic's over, that it's still very much a concern in Open Door.
Yeah, it's a huge big concern, and we'll circle back toward the end.
But so much that there are treatments that they curtailed and have yet to reinstate.
And diagnostics available to the community are not really available. Like pulmonary function tests, I don't think you could get them at all at Sutter. And I'd love to be corrected on that because they just kind of disappeared and never came back. Mad River Hospital, you can get them, but you're talking about delays in, getting an appointment that are months.
Wow.
Yeah.
Wow.
So 1 to 2 months delay. And so if somebody can't breathe, I don't know, I think they need quicker attention. So because asthma is a reversible disease, and some days it's going to be more apparent than other days, if you're going down to your golden appointment at Mad River Hospital and all your stars aligned and, everything goes as smoothly as possible, you might be breathing okay that day. So And so what the numbers they might get might not indicate that you actually have asthma or any other breathing issue. So what they do then is they do a test called a methylcholine challenge test, where they give you this noxious exposure to a chemical, and it's guaranteed to make you go into a little artificially induced asthma
Oh
fit.
my God, that sounds nuts.
I know it is. It's terrible. Anyway, and so then they can go, aha, there it is.
Well, yeah, but
Okay.
and I suppose there's differences that they can pick up on. So because if it's triggering asthma every time, it seems like every time they go, aha, there it is.
well,
Everybody's got asthma. It takes this
Let's stop doing that. So no, it's specific for asthma. So it is a pretty good test.
Okay.
And it does give some diagnostic clarity for a disease that's a little bit obscure sometimes.
Okay.
So the other thing that's helpful is allergy testing, also super hard to access in Del Norte County. The allergist, the closest one that I know of is who would be the best one to go to would be in Humboldt County. And the reason I say they're the best ones in Humboldt County is because we have a similar like pollen pattern and stuff
Right.
like that. So if you went to the one in Reading or the one in Medford.
Oh, yeah. That'd be different.
Yeah, they're looking for something else. And you have to be really clear that you're from the coast because
Right.
it's a whole different, environment and the pollens and things are super.
So allergists aren't,
variable.
is it a COVID situation, or is this just historically because we're Del Norte and there's fewer services here?
The allergist situation is just the baseline Del Norte lack of access to care to specialists.
Wow. Okay. Yeah, sure.
Yeah, and the one in Reading is actually super helpful. And the one in Medford, I don't know well enough to have a comment on, but even after a long time, they sigh and they say, don't you guys have somebody closer?
Nope.
And do you really want somebody with asthma to be driving on 299 with maybe fires going on?
Oh my God. Yeah. Right.
Yeah.
Right.
So
that's got to be a concern. I imagine these are in the notes, but
Yeah.
fires and the seasonal.
right.
Yeah.
All that kind of stuff. So, and I have personally seen people that have been kind of clinically diagnosed, but actually have something else.
Ooh.
And so if you're out there and you have been diagnosed with asthma and you're doing everything that your provider has asked you to do and you're still not better, then you should talk to your provider about getting some of these diagnostics done. Because I have seen people recently who were not recognized as having other diseases, and their disease was just called asthma.
Oh, wow. Okay.
And it didn't end well. So how do you know whether you're doing well or not? There's something called the rule of twos that we've talked about before.
Okay. How does
Super
who know
important.
if they're doing well or not?
Well or
Somebody with
not.
asthma?
Yeah.
Okay.
So first of all, I'll backtrack a little bit, saying there's two kinds of medication for asthma and two general categories. There's a maintenance category, and so those are meds you take to keep from getting the symptoms.
Okay.
Okay. And then there's rescue meds that you take. Most people are really familiar with the rescue. They're really focused on the rescue, and they have it really heightened awareness of feeling sick, using the rescue and getting better,
Right.
as opposed to feeling sick, using the maintenance and not getting better. So the thought is that the rescue is the only valuable medicine, but really the maintenance is the most valuable. So when you're looking at rule of twos, if you are using, so one of the rescue medicines is albuterol, okay, also called Ventolin, also called Proventil. And that's the one you hit when when you're wheezing or coughing
Right.
and kind of miserable. So if you're using more than two of those a year,
Ooh.
if you're using it more than twice a week, or if you're waking up more than twice a month with breathing issues, then your asthma by definition is out of control
Ooh.
and permanently worsening.
Okay, so go that. You mean if you go through 2 of the inhalers in a year?
And people go through one a month.
Yeah,
Up
right,
here
right.
commonly, and it's never commented on. But I think
Wow.
the rule of twos is super powerful thing for Joe average patient to know.
Okay. No, so let's go through it again. If you go through 2 of the inhalers, the rescue inhalers,
The rescue inhaler, aka albuterol, Proventil, or Ventolin.
if you go to
It's the little blue one.
2 of those a year,
Yeah.
or you use it
more
twice
than twice a week.
More than twice a week.
Or you wake up more than twice a month with
Okay.
asthma symptoms.
Wow.
So if somebody is doing that and all they have is a rescue inhaler, then their asthma is worsening. Number one, that worsening is permanent. Number two, and they need to go to their primary and say, hey, breaking the rule of twos. And so I need another intervention, right? And
Right.
so the other intervention would be maintenance medication.
Okay.
And so maintenance medication is usually inhaled steroids. That's what people are on chronically. Sometimes they're treated with it's kind of like an antihistamine singular. It's a commonly advertised on TV for kids.
Okay.
So it's another asthma maintenance medicine. Or if they're really in deep trouble, then they need a burst of prednisone orally.
Okay.
So really important to know.
Is that more dire than a rescue inhaler?
Yeah.
Okay.
Yeah. That's when you're maybe hitting your inhaler like 12 times a day and it's not working for very long.
Okay.
So those people sometimes they get oral prednisone. Sometimes if they end up in the ER, they get IV, not prednisone, but Solu-Medrol. So steroids. essentially,
Right, exactly.
Which have their own side effects. So people out there are like maybe scratching their heads saying, what, steroids, chronic steroids?
How do steroids treat inflammation? Because typically that's a
They tone
therapeutic
down
treatment.
your immune. The easiest way to look at it is they tone down your immune system.
Okay, dial everything back.
Inflammatory response. So what else does that do? Well, that can make you more likely to not have a good immune response to acute illness. Like a virus or something.
Sure, one of those instances when you'd need.
Yeah.
Does it dial back other immune responses, or just specifically honing in on inflammation?
Inflammation.
Okay.
But it also causes other side effects. So if it's used over a long period of time, then osteoporosis becomes a concern. That's a thinning of the bones and a weakening of the bones, and also cataracts. And this isn't really talked about in the exam room very much. But definitely the benefit of breathing outweighs the risks of the other. I mean, there's medical management for those, and those don't happen very often.
Yeah.
Okay. So I'll keep that into perspective.
Wow. Okay.
Yeah. All right. So asthma is graded depending on severity and persistence. So it goes from mild to moderate to severe, and then intermittent versus persistent. And so if you're in the exam room seeing a patient, as far as you know, it's intermittent because you only see them intermittently.
Right.
So that's why this rule of twos can be kind of important, because it helps the provider define specifically what kind of asthma somebody has, at least what the severity is, and that defines the management.
Sure, and that's on you as the patient.
Right. So I think teaching people about rule of twos is super important. And you can go with there's layers of medication. There's like 4 or 5. And I noticed there was a new one that you can actually take that if somebody was in severe trouble, and there's a couple people around who can kind of get there in this community, then they have immune modulators that are similar to what they'd give to somebody kind of in the same MAB category that somebody with rheumatoid arthritis would get, or somebody with lupus would get,
Wow,
or
okay.
psoriatic arthritis.
Okay.
So they're actually treating the immune system directly.
Yeah.
Instead of just trying to be an on-off switch. Yeah, so that's kind of cool.
That is kind of cool.
Yeah. So I think if I was going to see my provider, maybe, I get a lot of patients who come in for yearly physicals and just health check-ins and mostly wanting blood. I would say if I had asthma, I would say, so monitoring the rule of twos, kind of breaking it mostly in the fall. I think I, maybe have an allergic response to mold or mildew. What do you think of that? And the provider should act on that.
Right.
Yeah. Either looking at the med list and knowing from the type of asthma they have what they should be on and are they on it, or noticing, maybe changing their understanding of what type of asthma they have, and then treatment follows that.
Okay.
Super important, super easy, super hard to do.
Yeah, and you've got to. I mean, it seems you work together ideally with a healthcare provider, to
Who
provide
knows
that.
you, who's been around a while.
Exactly,
Yeah,
and
that kind
can
of stuff.
provide their end of that larger context. But you also have to come. You have to come with what's happening at home, what's happening when you're not sitting right in front of them. Yeah.
And Rule of Twos does not only apply to Sith Lords, okay?
To what?
It's Sith Lords. There's a Rule of Twos in Star Wars.
Okay, that's lost on me.
Yeah.
Sorry.
Okay. So there's other things that play into asthma. We've alluded to allergies. We live in a temperate rainforest, at least for the moment. And so there's lots of allergens up here. And because it's we kind of live in a humidifier, there's lots of, that's another stimulant for genetically predisposed people to get asthma.
Okay.
But there's also stuff you wouldn't think of. So heartburn plays
What?
into here.
What's
yeah,
this?
Like, what?
Yeah.
Like 9% of people who have asthma have it because they have heartburn. And if their heartburn was treated, their asthma would be under control.
You said 9%?
About 9%.
Wow.
I know. Who knew that?
How does that even begin to work? I mean,
Well, acid's coming up in, hits, in some people, it actually goes into the eustachian tubes and into the middle ear. But on its way there, it can go into the main bronchus of the lungs.
and just the presence of the acid inflames.
Yeah.
Okay.
And then
Wow.
your body is what? Better put some inflammation out here.
Huh.
To kind of try and repair the damage.
Okay.
So people are actually, when they're sleeping, they're actually inhaling to a certain extent some acid.
Ew.
And it's gross. Huh? And it also has bacteria and stuff from stomach contents. So if it gets really, really bad, you can get an aspiration pneumonia from it. But that's
Oh my God.
further down the road than we need to go.
That is, wow.
I know. It's kind of scary if you guys only knew.
Oh God. So, all right. Yeah. Some future health matters. I think we need to go down that rabbit hole. That is, I'll be damned. I hadn't
Yeah.
thought about that.
So the other
Ew.
thing that happens commonly up here is that people get postnasal drip. We
The
know it because
crud.
even in polite conversations, it's not too much of a problem to snork something up,
Nope.
step away from the circle and spit it.
Right.
We're kind of all used to that. So that's
And
usually,
people who just move here experience that.
right. And they're horrified and distressed and everything, but it's kind of like what we live with.
Yeah. There's about maybe I'm not every year, but some years, 3 weeks or so, I walk around. I feel like I have a cold in almost every way, except I don't feel sick. It's
Yeah.
just everything else around the outside
Yeah.
is inflamed and snotty.
Right.
Yeah.
It's just like mucus overload.
It's the Del Norte cruds, is what it's been called.
Well, Del Norte crud's a lot of different things, but
Wait, really?
yeah.
Okay, then we need a whole episode on the Del Norte cruds.
Okay. It's kind of interesting, but this works at kind of the same idea as the the GERD or the reflux. So the reflux comes up and goes into the lungs. This is postnasal drip going down
okay, sure.
toward the lungs, and it triggers a cough mechanism. And if it gets past that cough mechanism, then you have the inflammatory response. The lung passageways try and protect, and they circle the wagons, they draw down, and then there's a lot of mucus there to actually protect the cells that causes people to not be able to take a deep breath
Right.
and to breathe kind of unencumbered. So postnasal drip, a huge cofactor in about 9% of people, about the same as with heartburn. And then the overlap, and allergies being another one. So
Okay.
allergies the majority. And then GERD and postnasal drip kind of in the minority, but the reality is all those overlap. So the Venn diagram hugely overlapped.
Okay.
So if you're working with your provider again and you're saying, hey, I'm violating the rule of twos and God, my GERD's bothering me, then the astute provider, of course, would target that.
Just a quick functional difference between COPD and asthma?
COPD is asthma is reversible. COPD is kind of permanent. I think if I had to super simplify it. Okay.
Same function, same inflammation of the lungs?
No,
Okay.
There's differences that you can tell on pulmonary function tests, but with COPD, what happens is not a bronchospasm or a tightening of the airways. It's more like an inflammatory. It's a different kind of inflammatory response where the airway walls get get kind of poofy and swollen.
Okay.
Okay. And then a lot of mucus is kind of generated.
Okay.
And, air can't really come in easily. Mm-hmm. And it goes out a little bit easier than it does in asthma.
Sure. But it's a different kind of inflammation then, and different over time. I see, the C is chronic, right? Mm-hmm. Okay.
Yeah.
That's what
Well, asthma is chronic too, but it's reversible.
Okay.
So until you get to a point, and then it's all bad. So, and you can have both, by the way.
Okay.
So if you have problems inhaling and problems exhaling, it's really a problem.
Yeah.
One is more of an inhaling kind of problem. One is more of an exhaling kind of problem.
Okay.
So, but your doctor can best guide you. Pulmonary function tests would define COPD if it was a player in somebody's illness.
Get on the list.
Yeah.
Okay, so I don't know what you have next. I'm curious about how is it reversible, but let's follow I don't have a copy of your notes.
How's what reversible?
Asthma. And up to what point? How does that work?
Oh, okay. Well, it's not necessarily that you're born with something really severe. If it's appropriately treated with maintenance medication, like and an allergy treatment and GERD treatment, if it's relevant, then you just never get to the bad part.
Okay.
I don't know how else to answer that.
No, sure. You don't progress, right?
Right.
Yeah. But I'm just curious. You said it was reversible.
It's not like reversible. You never have to think about it again. It's like reversible in the moment. You're okay for a while until
gotcha.
you hit another trigger.
Gotcha. But
it's not like you're cured.
Right. Okay.
It's like you're under control.
I have you. I get you now. All right.
Yeah. Sorry. So one thing that's important, that the doctors that decide how to treat asthma are really insistent on people getting flu shots. And I think it's a really good thing, because influenza, the combination of influenza and asthma. So what are the triggers of asthma? Viral syndromes.
Okay,
Influenza, huge, big viral syndrome. So it's important to get your flu shot. And then kind of by the same logic, COVID. Okay. So there's a new COVID variant. We're about ready to start a new wave.
Okay.
Yeah, sorry, I brought the bad news. So BQ.1.1. So right now it's defined as a subtype of Omicron, but it might become its own new little Greek alphabet letter.
Oh, wow.
So either pi or rho.
And I imagine it's too soon to tell how the multivalent vaccine is working against it?
Yeah, this particular one is the most successful at getting around the immune system's defenses. So they're looking at it with a little bit of suspicion that it can get around. But again, vaccination keeps you off the bench.
And
so
it's not the only variant out there, too.
Right,
yeah.
Right. There's a lot of different things. In the beginning, I remember talking about COVID on this show, and I said, hey, if you have asthma, you don't have a lot of the receptors that the COVID virus uses in the lungs. And so far they think you're going to be okay. And that is still in agreement, but the people who do get COVID, who have asthma, especially poorly controlled, do worse.
Sure.
Okay. So that means getting vaccinated still is a thing. And it also means that rule of twos is important to ensure. It's the tool that you communicate with your provider to ensure your asthma is under control. So this new one, this new wave that's coming, it's about 11, this particular variant is about 11% of what they're seeing in New York.
Okay.
And New York is kind of like our canary in the cave.
Right,
okay.
right.
So they think probably in the next month we're going to be in it again.
Okay. Well,
so
time to get vaccinated in just about all manner of seasonal vaccinations. I know we've got plans to take care of that. I was waiting for a week when Lisa wasn't on the road. So if there's any sort of response, we can just chill over the weekend.
That's good.
We have a cat that was diagnosed with asthma.
Oh, how interesting.
It was, and he'd wheeze and he'd have these things, and I thought it was hairballs for a long time.
How did they do pulmonary function tests on him?
No, what they did was they just went ahead and gave him medicine to see if that dealt with it.
Oh, and he got better.
Yeah. Yeah, and it was like once a day steroids, and then now we're down to once every 2 days, and on the verge of phasing it out. But yeah, cleared up. Like he had, after we started the steroids, he had one wheezing attack.
Steroids are amazing things.
Nothing since.
Yeah, they're amazing things. I wonder if he's allergic to cat dander. Oh,
It wouldn't surprise me.
Yeah, because a lot of people's triggers, we focus on the mold and the mildew and all that kind of stuff up here. But, it can be all kinds of stuff. Cat dander, dog dander,
You need
feathers,
particulate,
feathers and down, comforters. Anything you sleep around, you're around for, let's say, average 8 hours a day.
Sure.
And that can spark an allergic reaction.
Yeah.
So dust mites, we have little mites crawling on us while we sleep. It's super gross.
I've always loved that idea. I don't know why. That's never grossed
We
me
have
out.
ones on our eyelashes.
Yeah, I know.
Maybe
That's
that'll
cool.
gross you out.
That's just walking around with these things all the yeah.
So anyway, people develop allergies to them because we become allergic to things we were repeatedly exposed to, and
That's
most of that
weird.
is what's going on where we sleep. So if your house is under the redwoods and maybe a little moldy, then mold might be a contender. For me, my personal trigger is known. It's gluten. So I don't have celiac. I'm not gluten intolerant. I'm gluten allergic. A whole different thing.
Okay.
Yeah. So if I am not good with my diet, which I never am, and I eat some bread, then I'm wheezing about 10 minutes later.
I'll be darned.
Yeah,
Wow.
I know. So I'm going with denial on that one.
That doesn't
Yeah.
exist.
Yeah. So not a problem here.
Well, Lynn Szabo, thank you very much for this week's Health Matter. That was very informative about asthma because so many creatures and loved ones all around me suffer from asthma. So it's a nice little insight into what they have to think about and go through. Any ideas about next week?
I'm still trying to get Mike here. He's had some scheduling conflicts, but we did have a meltdown of the pharmacies kind of about a month and a half ago. And it might be interesting to see what's unique about Del Norte and that, and then what is like the state of rural pharmacies.
Right.
Because I suspect we're not unique. I suspect that this is kind of part of the rural access to healthcare issue.
Okay. That'll be informative. That'll be really
I'll see
informative.
if he's a busy man, and he'd rather take care of patients than come in here.
What?
Yeah.
Well, Lynn Szabo, PA, thank you so very much, and we'll see you for next week's Health Matters.
Bye-bye.